Matt, this is Jen. I don't think she can hear you.
Okay, I'm gonna get rolling then. Just kind of, unless you tell me otherwise. Kallie and Tracy, you okay? Okay.
Yep, good to go on my end, thanks.
Okay, so welcome everybody to the Friday press call. As usual, I'll walk you through our. So Whitney can't hear me for some reason. I can get in the chat, but we'll just keep going anyway. Since unless you all give me the thumbs down that you can hear me, I'll assume that you can. I will walk through our surveillance report. I do have a couple of slides I want to share with you after that. And then I'll turn it over to Tracy and Kallie, and then we'll take questions. If that's okay with everybody. So this should look familiar. This is our weekly report. Right now we're seeing, oh, wait a minute. There we go. Actually, yeah. So this is our weekly report. You can see we have a little bit of on the fly editing going on here, but we're seeing about 25.8 cases per 100,000. That's down slightly from where we were. We're getting pretty close to that 25 cases per 100,000 threshold that Harvard School of Public Health and others use as kind of the threshold of uncontrolled spread. That's good. I'm going to share with you some slides. Again, the frame of reference here is really since the fall. I'm going to share a slide with you to give you a little bit of context. While we're down significantly from where we were in November, and that is absolutely a good thing, I want to make sure that we're keeping in mind the long term, and we're still above where we were pretty much any time last year. It's good to see that number creeping down again. We were kind of on a plateau there for a while. Hopefully that'll continue in the weeks ahead. Our case positivity also came down this week from last week a little bit. We're at 4.7%. That's just nudging down under the 5%. We haven't been there in a long time. That's good. If you take out the Big Sky surveillance numbers, with that, this number edges up to about 6.9%. Again, like I say every week, that there's not one or the other that's right or wrong. We just want to make sure that we're thinking this through. That Big Sky surveillance testing is really happening in a very specific geographic area. So it's important that we consider it. It's also important that we understand it's probably not representative of the entire county. Hence the two figures, but overall we're now under 5% with factoring in those Big Sky numbers, surveillance numbers, and we're a little under 7% without those tests factored in. Testing turnaround continues to do pretty well. We're seeing our median time from specimen collection to positives received by public health at about between 1 and 2 days, depending on the day. But the median time for the past week was 2 days. But you can see there are days when our median time is a 24-hour turnaround. That's positive. That helps us get to cases faster and get them isolated and reduce spread. It also helps us to identify their close contacts and get them into quarantine. We're getting most people, we're getting those results within a day or two. That's good. That continues onward. And we're getting our contact tracing capacity. We're able to get those case investigations started within 24 hours to a large extent. Here you can see the epidemiological curve of people when they became sick or started feeling symptoms. For those who did feel symptoms, those cases who did feel symptoms, you can see that peak in November. You can see another peak in January, and then we've had a reduction now. Be really careful about this interpreting anything in that orange shaded area. That's really incomplete data. Here you see, again, this is familiar. The age groups, the younger people tend to be more inclined to contract the disease, being led by people in their 20s and 30s. That's nothing new. We've been seeing that for months now. MSU, we're seeing active cases, excuse me, still well within MSU's capacity to do isolation and quarantine, and seeing that again fairly steady at MSU over the past week and really over the past month. Hopefully that will continue. And then we are seeing cases in schools. Those tend to be a little bit more complex contact investigations. That work is ongoing, and we're continuing to see cases generated there. Last week at this time, I was able to let you know we didn't have any cases in our long-term care facilities. That's changed. We've got 3 or 4 cases, 1 each, and I think 4 long-term care facilities as of this morning. 1 resident. That's, we want to see zeros on those, but we're going to continue to work hard to keep cases out of those facilities. So we're not at 0 there anymore, but we don't have an extraordinary number of cases in those long-term care facilities. Those are very concerning when we do have them, because those are the places where we tend to see higher mortality. And I wanted to share with you a couple other things, if I can get my screen to work. There we go. So you can see here, this gives you a little bit wider lens view of where we are. This is the number of cases we have by week, looking back to a year ago, really. And you can see we've come down really significantly from where we were in November. That's really good news. But if you kind of look over and you extrapolate a little bit and look where we were last summer, we are still at a fairly high plateau compared to where we were before we saw that fall surge. We still are seeing a significant number of cases. The concern there is that's a high platform to start if we do have another surge. With those variants out there, with some of the changes that we're seeing statewide with regard to how we're managing activities, those community interventions, the going away of the mask mandate statewide, and some of the restrictions being lifted on certain businesses, including in Gallatin County. We need to monitor this closely, and the concern is that we're at when you start out that fairly high platform, plateau, it could get it could accelerate faster. The other thing I want to talk about is where we are in vaccination, in the vaccine distribution process. We continue to be in phase 1B. The people in phase 1B include anybody who's age 70 and older, American Indians and other people of color who may be at elevated risk to COVID-19 complications, and people who are younger who have certain specific underlying health conditions. I'm going to read those out today. It's cancer, it's chronic kidney disease, it's COPD, it's pulmonary disease, Down syndrome, certain heart conditions, immunocompromised people from a solid organ transplant, severe obesity, type 1 or type 2 diabetes, sickle cell disease. And there's wiggle room there for medical providers who have somebody who may not have exactly one of these conditions, but they believe is at an elevated risk. And so that process can work through healthcare providers. We are still in 1B, and we're going to be in 1B for the time being. what I want to, bear with me.
We may have lost your audio, Matt.
How's that?
There we go. Perfect. Thank you. Sorry.
We continue to have limited doses of vaccine, and we're continuing to make vaccine available to people under phase 1B. And I'll talk more about those numbers in a minute. Again, it's people 70 and older. It's people with those very specific certain underlying health conditions. People were still giving vaccines to frontline healthcare workers, people in 1A, people who live in nursing homes, who work in nursing homes and assisted living facilities, and people of color and American Indians who are at higher risk of serious disease. We know there's great interest, including among people who are not eligible under 1B yet. It's come to our attention over the past week, both in our clinics at the fairgrounds and the clinics that are happening at Bozeman Health, that there's a small number of people who are not yet eligible for 1B who are finding ways to sign up for clinics. In some cases, those are people who are uncertain. And I think in a lot of cases, those are people who are uncertain, who are hearing about ways, backdoors into clinics, and they're uncertain about whether they should sign up, and they're reaching out to us and they're saying, hey, I don't know that I'm eligible yet, but can I sign up? And our answer to them is no. In some cases, I would suppose there are some people who are consciously jumping the line. We need the help from the community. We need you to understand that if you are not in a group that's currently eligible, please don't try to sign up for vaccine clinics. Any dose used on someone who's not eligible for 1B is a dose that's not going to somebody who's at higher risk. Please wait your turn. We know people are eager. We know this can be a confusing process. We know that there are people out there who have reached out to us in a variety of ways to say, hey, I got this link forwarded to me. It doesn't feel right. I don't feel like it's my turn. And we're saying, yeah, you're right. It's not your turn. If you get invited into a clinic, we need you to make sure you're eligible under 1B, and we need you to not to forward those links around. The systems that we have to be able to run these clinics are being given to us by the state. There are some ways that we can make sure we can look in and see whether people are eligible, but when we're giving thousands of doses a week, that's pretty challenging. And what we really need is help from the community. Everyone's going to get their turn. We're going to work through this, but every dose that we give to somebody who's young and healthy is a dose we're not giving to somebody's grandparent. Every dose that we give to somebody who's young and healthy is a dose that we're not giving to somebody who has one of those serious underlying health conditions. So I really need your help in that. I think Kallie's going to talk about that a little bit. For the most part, I think people are just trying to do their best. They're just trying to understand the system. There's no nefarious intent. So that's why we're trying to communicate today. We want people to understand we're still in 1B. If you don't fall into one of those categories, please just wait. We don't need you trying to sign up for those clinics, because right now we're not giving those shots in Gallatin County. With that, I will turn it over, since I think Kallie has some similar comments. I'll turn it over to Kallie next.
Excellent, thanks, Matt. So I'm Kallie, I'm Bozeman Health Incident Command Lead. I'd like to start my update today with a focus on our COVID-19 vaccine scheduling process. Since we started community vaccines for those in the phase 1B criteria, we have been consistent in sharing that Bozeman Health patients would hear from us directly to schedule a vaccine appointment as we received vaccine allocations. We continue to follow that process. If you are a Bozeman Health patient and you fall within any of the established criteria for each of the different phases, you are on our list. And as Matt shared, right now we are immunizing those within phase 1B. Bozeman Health is directly contacting small groups of patients within phase 1B to sign up for a vaccine appointment as we receive vaccine allocations. So this week, we've learned that some patients we contacted to have them sign up have taken the link specific to them and shared it with multiple people who are not with phase 1B. Unfortunately, those people who did not meet actual 1B eligibility were able to receive a vaccine dose when they shouldn't have, even though we have a screening process. So Bozeman Health, our wonderful team members and our partners at Gallatin County Health Department, MSU, and CHP are working really hard to ensure that just phase 1B eligible individuals are receiving a vaccine. If you are not in phase 1B and you have not directly been contacted by Bozeman Health, please do not sign up for a vaccine appointment. I want to assure you and our community that we are doing everything we can do to make sure that only those within phase 1B eligibility are receiving COVID-19 vaccine at this time. We spent a lot of time this week looking at our operational process to validate that the following is occurring: that we are only directly contacting patients that meet phase 1B criteria as defined through our electronic health record, which we confirmed that we are. That the sign-up form asks if the person filling out the form meets phase 1B eligibility, and that form does. That when an individual arrives to receive their vaccine, that we are validating their date of birth and asking if they have a qualifying medical condition as outlined within phase 1B. And after looking into that, we are asking all of those questions when they present. So we ask all of our community members to please continue to be patient. We are as motivated as you are to immunize all those who wish to be protected against COVID-19. We have a process, and we really need folks to understand that not following that process makes it extremely difficult for everyone. So thank you for your patience and for your honesty and for helping us ensure a smooth process for everyone. I'll give just a quick update on a couple other topics. Currently at Bozeman Deaconess Hospital, we have 70% of our critical care beds occupied, with 83% of our non-critical care beds occupied. To date, we've administered 3,960 vaccines to community members. Our employee immunization rate is 76%. We have not wasted any doses to date. And as we continue to immunize more community members, we are starting to look at our infection prevention measures and our altered operations to see what we will keep as a regular component of daily operations and which ones we may be able to slowly phase out as more people are immunized. We continue to work closely with our partners on this call and appreciate you taking the time to talk with us today. Thank you so much.
Thanks, Kallie. Tracy, what do you got to tell us today?
I don't have any updates today, but I'm here for any questions.
Great, thank you. So just in general, I want to say we started just an update on vaccine administration. We started the week at the state dashboard, and as I'm sure you noted, we had administered 10,499 first doses in Gallatin County. As of today, we've been allocated in Gallatin County just over 2,000, above that, 12,525 first doses. This week, the health department, and through its incident command with the Department of Emergency Services and other partners, administered over 1,000 doses at the fairgrounds. And I know that Bozeman Health administered over 1,000 doses at the hospital. So when that dashboard updates next week, you should see that our number will grow past 12,000. We don't have any vaccine left in our fridges. We don't have any vaccine left, first dose vaccine left in our fridges or our freezers at the health department. We're getting that vaccine out as soon as we get it. We had a number of points of dispensing going on today. Today at the fairgrounds, the Veterans Administration is using the fairgrounds facility to provide, I believe, second doses to some of their maybe first and second doses to some of their population. Next week, we're going to be spending a lot of time at the fairgrounds giving second doses as people come back through, and we'll be working with community health partners with their patient base to provide a clinic for the community health partners patients at that facility. So we're continuing to get as we continue to get vaccine in, we're getting it into arms. As Kallie said, we're not wasting any vaccine. Our nurses are doing a tremendous job getting as much out of every vial as they can. our team is working at an extraordinary pace to get this done. Those clinics are running really smooth. And we're planning for the future where we hope that we see larger allocations in the future. That's challenging because we don't really know how to plan for that because we don't yet have those figures. But we're hopeful and we're trying to plan for how we're going to be able to use more vaccine if we do get it. Again, that will be challenging if and when the time comes. As we move through this, we're going to be continuing to work with Bozeman Health. We'll continue to work with MSU. We'll continue to work with community health partners to find ways to be efficient. This is taxing on all of our organizations. Bozeman Health is running test sites. They're also seeing patients for every other reason that they normally do. The health department is doing contact tracing. MSU is running test sites. This is hard work, and this is taxing our organizations, but we're committed to it, and we're committed to continuing to find ways to expand that supply of vaccine when we do get larger allocations in the future. With that, I'll throw it open to questions.
I had a question if no one else has one first. I'm wondering if you have any numbers on how many people may have kind of jumped the line into the 1B phase who didn't qualify?
I don't think it's a huge number. I think I don't know. I don't have a number for you. I know it's just something that we dealt with a little bit at the fairgrounds. I would say it's probably more than 10, but fewer than 50 is what we were dealing with. But it's hard to put a number on it. Some of those folks came and they just had genuine questions. The other ones called us and they asked and we said, no, we think you should give up that appointment. So we don't have an exact number. We didn't really keep a count. We just need help from people. The other thing is it's hard to know sometimes exactly whether people are eligible or not. So we're working on those processes as well. Kallie, do you have anything to add to that?
No, I don't. No. Thank you, Matt. I think you covered it.
I will say what's been impressive to me is the number of people who have reached out just confused and wanting to do the right thing. So we understand this is a stressful, confusing process. I think most people are just trying to do the right thing, but they're also eager to get the vaccine. And so when an opportunity presents itself, they feel the need to jump at it. They're really thinking that through and they're contacting us. I think communication is going to be important, and making sure people understand will help us address that issue.
Okay, I was also wondering, in terms of the number of doses Gallatin County has received so far, has that gone how you expected, like the quantities there, and do you have any sense of when we might see more than just like the 1,000 or 2,000 every week?
I really don't. It really kind of has to do with a lot of variables that we don't have control over. I don't know what demand is like in other parts of the state. If other parts of the state start to become saturated, I would imagine that we might see more doses come our way. I know that the Johnson & Johnson vaccine is winding its way through the approval process, so we might start seeing doses of that vaccine within the next month or so. That'll have a really significant impact. It really has to do with the supply and the demand, what's happening in other parts of the country, and we're asking for as much as we can get. That said, it's challenging because we need to plan, we need to staff, we need to find facilities. When you give one dose, you've got to plan a clinic for that second dose 3 weeks or 4 weeks later. So having that long-term ability to know what you're getting is really valuable. We just don't have that right now. So I don't know. I think we're expecting it, we're planning for it, but we don't know when that might happen.
This is Ed O'Brien at Montana Public Radio. The disaster that is Texas and I guess Pacific Northwest, they've had their own ice storms. Have you heard of any possible supply chain interruptions that could further hamper this?
I have not been made aware of that. I don't know that that's affecting us here in Montana. If it is, they have not let us know that at the local level. And there's been nothing, no communication that we should expect disruptions in supply that I'm aware of at this point in time, Ed.
Thank you.
Hey, Ed, I'll jump in. This is Whitney. We did have one shipment that was delayed by 1 day, but it did not impact any of our clinics. So from the health department standpoint, so we had a shipment of 975 doses that came in a day late, but it didn't impact us. So that's what we've seen so far.
Thanks, Whitney.
Thanks, Whitney.
And this is Lauren from Bozeman Health, and we experienced that same delay that Whitney just spoke to, but it did not affect our clinics for this week.
Thanks.
I think it's also important to note that the delivery groups have procedures in place for repackaging those to ensure that they remain viable.
Interesting.
Other questions out there today?
I've got one. Just a little bit random. I was kind of saving it for the end just because it's got some randomness to it, but just heard mention from watching legislature this week with House Bill 257, the one that would impact boards of health in terms of the regulations and the restrictions. Do you have any thoughts on that that's on the board?
You know, it's hard, Cody. We have local health departments, local health officers, local boards of health really have their heads down working on vaccine distribution, contact tracing, trying to serve our community. We're aware that some of this legislation is winding its way through the legislature. We're aware that some of it seeks to take authority away from local boards of health, and some of it is troubling. Some of it seems like it'll confuse the process. It'll make the process longer. We have folks who we're talking to in Helena. The health officers have been communicating with the governor's office. My hope is that as that process happens, that people understand that the public health system, public health practitioners are working their guts out to serve their communities. And we understand that there is frustration with the pandemic. But I hope that people aren't acting out of frustration. I hope they're acting out of a genuine hope to make the system stronger, because we're going to need a strong system. We're not done with this yet. And if we're making the system more complicated, if we're making it more confusing in terms of how local health rules get put in place, that's a problem. It's also a problem. Local boards of health under state law have the duty to take actions to protect public health. The versions of the law that I've seen aren't changing that. They're continuing to place in local boards of health the duty to protect public health, but they seek to separate from that the authority to make those decisions and put it in some cases in the hands of politicians. And that, I understand the desire, I understand the frustration that's out there. It's very concerning to us, but frankly, we don't have a lot of time. We're trying to get vaccine out to people. We're trying to limit spread of the disease. We're really trying to keep our eyes focused on that ball. I'm hoping that Governor Gianforte and legislative leaders will understand that the local public health system has gone through a huge difficult event here over the past year, and that they really need to take responsibility so that when these changes are made, if they're made, that they're changes that strengthen our public health system rather than make it more convoluted and confusing.
Good. Thank you. That's all I had.
All right. I appreciate it. There's one last call. If anybody has any other questions, otherwise I'm going to let you go.
Sorry, I think I have one more.
Sure.
I'm wondering, since it's been a bit since the rules on bar closing times have changed, have you noticed any impact of that rule change?
Well, you saw our numbers. Our numbers are looking pretty decent, but we're just over one incubation period away from that rule change. So you wouldn't expect to see big significant differences at this point in time, or just be starting to see them. I can tell you we're in touch with the Licensed Beverage Association here in Gallatin County. We do get complaints. We're sharing those complaints with them, trying to find ways to take care of problems when we see them. We've gotten complaints about mask use predominantly. We're sharing that with them. I'm hopeful that, you know, we can work with them and find ways to make this work long-term though.
Okay, and the last thing I had, I was wondering about tracking of variants of COVID, if you know if that's happening, if you have any sense of when that might happen.
I asked the state that last week, and I know that they send a certain number of specimens to the CDC. That really happens at the state level, and I guess I'd have to refer questions on that to John Hebelt and the folks at DPHHS, exactly how that's happening, how that monitoring is happening. All right, folks, thanks for your time. Have a good weekend.
You too, Matt. Thank you.